But now it's our last interview for the first hour of the show, and joining me is Dr. Keith Cloete, who took over as the new head of department for the Western Cape Department of Health in April, right around the time that COVID-19 began to take hold of South Africa. So over the past 6 months, he's been hard at work helping to spearhead the province's response to the pandemic. Dr. Cloete, thank you so much for joining us this morning. Welcome to our birthday broadcast. Is there anything you'd like to add to the introduction, and how are you doing?
Thank you so much, and it's an absolute pleasure to talk to you on this very important day of celebration for Red Cross Radio. I would just maybe like to add that I've worked in the healthcare department or the Western Cape Department of Health for 28 years, and I've met the most amazing people that work in this department, and that has been what has made my introduction to the department, being the head, so special. But the most other thing that I would also like to add, it's just been incredible how people in the last 6 months, how the best of humankind has come out of people during this period.
And now, the province's response at the start of the pandemic was arguably the most important, as it dictated how the pandemic would affect the province in the months that followed. And you stepped into your role right at this time. So, what was it like stepping into the role as the pandemic began to take hold of the country and the province?
I must be honest with you, it was quite daunting, a little bit of a blur, if I look back, and quite scary. And it's mainly because we didn't know what was coming. It was something that we have not faced at all, ever. And that uncertainty made it a very daunting task. But looking back, as I said, there were so many people and so much kindness and so much support that actually looking back, it has probably been a wonderful experience, I can now say, because of how people band together to make a difference.
And today is RX Radio's third birthday. Several of the guests have already spoken about how much of an impact RX Radio makes at Red Cross. But RX Radio has also been broadcasting in other hospitals like Paarl Hospital. So for you, what impact do you think RX Radio has on children's healthcare in the province?
It is such a wonderful initiative, and I think it's something that we just need to grow from strength to strength. Firstly, I believe that the impact is the importance of listening to the voices from the perspective of children. And it is so important as many more adults can see the world through the eyes of children, that would make the world a better place. The reach of RX Radio has been phenomenal in that we are also now at Paarl Hospital. I was very glad when that expansion came. And the dream should be that the expansion should be much wider than that. So I believe that the impact has been phenomenal. I believe the impact can be even bigger. And I think it is just wonderful that we can build on what has happened to date.
And what do you think the effect would be if RX Radio were to spread to more hospitals in the Western Cape?
I think one of the big things that I understand and which I would want to commend for is, it's the agency that the children themselves have by becoming involved. It's the sense of hope, it's the sense of excitement of involving children in media and in just talking and communicating, because that's ultimately what it's about. So the impact for me would be phenomenal if more children in more hospitals are reached, and more healthcare workers and others are reached, and communities at large as well. So I think the sky's the limit for RX Radio, and it's really an initiative that we really have to all band together to expand as far as we can.
And RX Radio is also a platform of communication for the healthcare workers. You've spoken about how you've been involved in the response to COVID-19 and how daunting it was at first. And we know that also all our healthcare workers have been hard at work on the front line over the past 6 months. So what would you like to say to them?
I think one of the things is to understand what is the role of a head of a department like myself. And I liken my role as somebody whose job it is to make sure that we bring as many people as possible together to make the lives better, so that frontline workers can do the best that they can do, the healthcare workers, and that is to serve the patients and their families with dignity, with empathy and compassion. So it's making sure that they have all the conditions they require to be able to do their work to the best of their ability. I would like to believe, as a healthcare system in the Western Cape, we've gone some way towards ensuring that our healthcare workers can do that. But that still requires the healthcare worker to arrive at work every day, to work with anxiety, to work in the uncertainty of whether they are going to get infected, what they put their families at risk and their fellow colleagues and patients at risk. So I have nothing but the utmost respect for how people have responded to their call, which is to serve people in need while they themselves and their families are anxious. And I can really just say it has been the most phenomenal show of what human beings can be. And I'm so proud of all the healthcare workers because they've really become the best of humankind that we can possibly have. And I salute them for that.
Well, incredible words, Dr. Cloete. And obviously, RX Radio is a platform that healthcare workers listen to. So hopefully that message will get out there for them to hear through Red Cross and Paarl Hospital. So thank you for that. And then lastly, obviously, RX Radio is also a platform for the children. So any children that are listening and to all the patients that are listening, what words of encouragement or advice can you give them during this difficult time?
I must say to you, I have got the softest spot for all children. I believe children are so crucial for all of us because one of the reasons why we actually do what we do, which is all strive to connect to our deeper purpose of making the world a better place, is making it a better place so children can be the best that they can be. My message to children is you are phenomenal. You remind us as adults when we sometimes maybe forget why it is that we need to do the best to make sure that the world is a better place. Please keep on believing and be positive and help one another and help show adults what the world really can be because you, in my mind, represent what hope can be and what the best of humanity can be. So thank you for being who you are and continue being who you are.
Oh, Dr. Cloete, thank you so much for joining us this morning, and thank you for all the work you've been doing to combat COVID-19 and the pandemic in our province. Thank you so much.
You're listening to RX Radio.
For and by children.
RX Radio. RX Radio rocks.